So much, Mr. Engel. The Chair recognizes herself. Thank you, ladies and gentlemen. Last year, State and USAID spent more than $52 million on global health efforts in Liberia, Sierra Leone, and Guinea combined. But I know in my constituency, they ask, where did all that money go? It has become apparent that these countries did not have the healthcare infrastructure in place to handle or contain the Ebola disease, and as we have seen, it can spread to Europe and North America. And with the communist dictatorship in Cuba sending hundreds of forced labor healthcare workers to Ebola-impacted countries, we've got to ensure here in the United States that we are taking every possible precaution. It is appalling that the Obama administration officials are praising the Castro communist dictators for forcing these workers, forcing them to go to Ebola-impacted countries in Africa. These healthcare officials do not have a choice. Their families face retaliation on the island if they don't go. They are forced to go as part of a coordinated PR campaign orchestrated by the regime for its own political agenda. And it's disgusting and shameful that we should be congratulating Cuba for forcing people to go to these countries, and ask the regime what happens to those workers if they're found to be impacted with Ebola. They're not allowed to go back to Cuba. Here are some facts about Cuba and its healthcare apparatus. In the 1980s, that same Cuban regime, the same people, sent HIV-positive patients to concentration camps. The regime has taken out life insurance policies on behalf of its workers, but instead of naming the families as beneficiaries, any insurance dollars right now go to the regime. The regime is not exporting its workers for free. It receives approximately $8 billion per year that it uses to oppress the Cuban people. Cuban healthcare workers receive less than 25% of the money from donors that's supposed to pay for their salary. The rest is confiscated by the regime. And finally, Dr. Shaw, I have a question for you, staying on the subject of Cuba, because earlier this year in April, you testified before this committee, and I asked you if USAID will remain committed to reaching out to people suffering under closed societies and dictatorships. Your answer was yes. And in September, President Obama spoke at the Clinton Global Initiative and stated that the administration, quote, will oppose attempts by foreign governments to dictate the nature of our assistance to civil society and oppose efforts by foreign governments to restrict freedom of peaceful assembly and association and expression, end quote. That is a good quote. Yet this week, there's a column in the Associated Press that says everything to the contrary. According to news reports, USAID is planning on rolling out new regulations that seek to prohibit USAID from working in closed societies. By coincidence, it seems that the new regulations are in line with a certain senator who has been pushing to normalize relations with Communist Cuba, and these attempts by Castro apologists may be a backdoor deal to secure the release of Alan Gross. I certainly hope not, because Alan Gross is innocent and should be released immediately, unconditionally, without concessions to the tyrants who have held him unjustly for over 5 years. So, Dr. Shaw, is it true that USAID would consider dropping programs wherever USAID was denounced? And if true, it would only benefit thugs like the Castro brothers and Nicolás Maduro, Rafael Correa. They will use this as an opportunity to gloat that they got USAID to cave and run away from its mission. Why is USAID calling and running away from democracy programs in Cuba and Venezuela and Ecuador, Iran and Russia? And will you, and if not, will you come out and set the record straight? Dr. Shaw.
Certainly. Well, Thank you, Madam Chairwoman. And I just want to highlight, I do want to stay focused on Ebola in this context, but I can assure you that I'm standing by the answer I gave you previously, that we are going to continue to work in difficult environments on democratic governance programs as we have for years. The framework to which the article refers is one that we are eager to discuss. I know have been discussing with your team, and I'm eager to discuss in more detail with you. I do not in any way believe it diminishes our commitment to that objective, and I can discuss how it's being implemented in that context. And I appreciate your comments about Alan Gross, and as you know, we work continually on behalf of articulating why he should be released through our colleagues in the State Department. I would like to just make reference previously to your comment about the $52 million spent in Liberia, Sierra Leone, and Guinea on health. It's quite worth noting that over the last 5 years, in all 3 countries, we have seen rapid reductions in child mortality and maternal mortality because primarily of expanded access to bed nets for children who would otherwise get malaria. Those reductions have saved a lot of child lives. And in fact, just over the last 8 weeks, we've had a massive bed net distribution throughout the region because malaria patients present with the same symptoms as Ebola: fever, nausea, vomiting. And so we want to make sure that we keep that under control as we're tackling Ebola.
Thank you, Dr. Shaw.
One thing I will say, what did happen is the healthcare workers got infected early in this response, and that did decimate their health systems. And that's why I think we are dealing with a much more complex situation than we otherwise would.
I appreciate your answers. Mr. Connolly is recognized.